So monoamine oxide inhibitor. So inhibit the enzyme monoamine oxidase, which is present in the brain, blood, platelets, liver, spleen, and kidney. So if you read the name monoamine oxide inhibitor, or shortly called MAOI, so they inhibit the enzyme called monoamine oxidase. So monoamine oxidase metabolize the amine, norepinephrine, and serotonin, and they are neurotransmitter. So the concentration of this amine increase with monoamine oxide inhibitor because they does not metabolize. So when does not metabolize, they increase in the blood. The client who have depression or have not response to other antidepressant therapy, include electroconvulsion therapy, may be given monoamine oxide inhibitor. So it is actually the indication. The common indication is the depression. If the first line of the medication for the depression not work, we use monoamine oxide inhibitor. So also they said concurrent use with amitriptyline. So it is TCA, antidepressant or dopamine, epinephrine, levodopa, methyldopa, nasal decongestant, norepinephrine, or tyramine content food or vasoconstriction may cause crisis. It's called hypertensive crisis. So monoamine oxide inhibitor not to use with these groups of drugs to avoid some bad effect. Concurrent use with opioid analgesia may cause hypertension, hypotension, both are bad, and both lead to the coma and death, or even seizure. So here's some example of monoamine oxide inhibitor, like it is called phenarazine, and another name is called Nardil, or selegaline, right? Or also silopramine or Parnet, right? Also isocarboxanide. So what are the common side effects? So monoamine oxide inhibitor basically inhibit monoamine oxidase, which is lead to increase the level of dopamine or epinephrine, norepinephrine, or serotonin in the body. And so when increase all of this, and it causes the side effect and adverse effect. Example, orthostatic hypotension, right? High blood pressure go down when change the posture, feeling restlessness, insomnia, dizziness, weakness, lethargy, gastrointestinal upset, dry mouth, weight gain, peripheral edema, anticholinergic effect, dry mouth, central nervous system stimulation, anxiety, agitation, mania, and restlessness, delay in ejaculation. So the side effect, most common dizziness, orthostatic hypotension, even if anybody use for a long time, they develop constipation, dry mouth, But hypertensive crisis is most important. So what else? Hypertensive crisis. So MAO inhibitor interact with many other medication, right? So already we discussed over-the-counter cold medication, which can result in severe hypertension. And do not eat the food which is rich in tyramine, right? So as this can cause hypertensive crisis, what they are, like avocado, bananas, beef or chicken liver, then beans, caffeine, also is cheese, eggplant, then meat is extracted, or papaya, resin, red wine, right? Beer, then salami, soya sauce, pepperoni, in chocolate and yogurt. All are yummy food, right? Food that contain tyramine. So tyramine and monoamine oxide inhibitor together can cause hypertensive crisis, right? So if your patient have hypertensive crisis, what we can see? Hypertension, occipital headache, and that radiating frontally. Neck stiffness, nausea and vomiting, sweating, fever and chill, clammy skin, dilated pupil, palpitation, also tachycardia or bradycardia. Antidote for hypertension crisis is called phentolamine, right? So here showing some effect over the body. So interact between dietary tyramine and monoamine oxide inhibitor. So influence of dietary tyramine in absence of monoamine inhibitor. Here showing normal, this is the normal nerve terminal, and this is the receptor, like norepinephrine receptor is here. So when food, like here, influence of dietary tyramine in presence of monoamine oxide inhibitor. So this is medication, stop the enzyme, and then increase in the amount of the neurotransmitter. Let me read it. Interaction between dietary tyramine and monoamine oxide inhibitor. In absence of monoamine oxide inhibitor, much of the ingested tyramine is inactivated by monoamine in the intestinal wall. Any dietary tyramine that is not metabolized in intestine wall is transported directly to the liver, where it undergoes immediate inactivations by hepatic monoamine oxidase. So no tyramine reach to the general circulation. And the second picture, this picture, going to read, and 3 events occur in presence of monoamine oxide inhibitor. What is that? Inhibition of neuronal monoamine oxide increase the level of norepinephrine in synaptic nerve terminal. Inhibition of intestinal and hepatic monoamine allow dietary tyramine to pass through the intestinal wall and liver and enter the systemic circulation interact. And number 3, on reaching the peripheral sympathetic nerve terminal, the tyramine promote the release of accumulate norepinephrine store and causing massive vasoconstriction and excessive stimulation of heart. So now here a picture showing some effect of monoamine oxide inhibitor and tyramine containing food together. Suddenly sweating, tremor, dizziness, increased blood pressure, or propounding or fast heartbeat, tachycardia. What are the nursing intervention? So we have to monitor the blood pressure frequently for hypertension, right? Monitor for sign of hypertensive crisis, and this is the sign, right? Sweating, tremor, dizziness, increased blood pressure. So if palpitation is frequent, headache occur, the medication is withdraw or need to talk to the healthcare provider. Administer with food. If the gastrointestinal distress occur, the client is instructed that the medication effect may be noted during the first week of therapy, but maximum benefit may take up to 3 weeks. The client is instructed to report headache, neck stiffness, or neck soreness immediately. The client is instructed to change position slowly to prevent orthostatic hypotension. What else? The client is instructed to avoid caffeine or over-the-counter preparation such as wet reducing pill or medication for high fever or cold. Monitor for the client compliance with medication administration. The client is instructed to carry med-alert card, indicate that monoamine oxide inhibitor medication is being taken. Administer the medication in evening to avoid the because of insomnia may result. When medication is discontinued by healthcare provider, it should be discontinued slowly, gradually. What else? So reinforce the instruction to the client to avoid the food that is require bacteria or mold for their preparation or preservations, and those that contain the tyramine. So no more tyramine. The client is tough about the food that contain tyramine and also consuming tyramine containing food when taking an monoamine oxide inhibitor as can cause hypertensive crisis. So do not eat the food rich in tyramine, right? Means as this can cause hypertensive crisis. What are the tyramine containing food? Aged cheese, avocado, bananas, red wine, salami, pepperoni, and yellow chocolate.